Peace. Okay, we're going to go ahead and get started because we have a lot to cover today. As much as I'm sure you love seeing my lovely face, I'm going to turn my video off for the majority of this presentation just to kind of help with my broadband and Wi-Fi issues, and we're very windy today, so you never know. So I'm hoping that helps. Thank you for joining us today. This is awesome. I'm super excited to be talking to you all. I am in the Des Moines, Iowa area, central Iowa, and I have asked you all to put in the chat where you're located, what organization you represent, and what your temperature weather is like today, so I can be jealous of you all in your sunny and 80-degree weather and not jealous of you if you're in the 90-degree weather. So a couple of housekeeping things really quickly. Like I said, this will be recorded, so you will get a recording of this presentation. You will also get a PDF of the slides. And then this is not continuing education, so if you do need like a participation certificate, go ahead and just send me an email. I'll give you my contact information on the next slide if you need something like that. And then ask questions in the chat as we go if you have them, and I'll try and go back through those at the end when we have time. But this is a pretty full presentation, so super excited to be talking to you all today. And we wouldn't be here without the wonderful partnership of the Florida Department of Public Health. And we have just been so pleased with our collaboration with the Department of Public Health. And I would love for Casey Ameki to, she is our contact at DOH over there, and she is wonderful to work with. And so I would love for her to say a few words before we get started. Casey.
Thank you, Megan. Hi, everybody. My name is Casey Omiki. You're close. Megan. Yeah, no, it's easy. It's a bit hard to pronounce. But I am the Human Services Program Consultant for the Maternal and Child Health Program at the Department of Health. And I have the pleasure of working with Megan to ensure that pregnant women across Florida have the opportunity to learn about Calprotectin so that we can save more babies from stillbirth in our state. So I'm very excited for this webinar today and for everything that Megan has to share.
Awesome. Thanks, Casey. Appreciate it. Appreciate our collaboration. So like Casey's last name, mine is a little hard to pronounce as well. So it's Auket, like pocket. I'm Megan Auket. I'm the Director of Programs, Associate Director of Programs with Healthy Birthday, Inc. My contact information is on the screen there. Feel free to give me a call. I love hearing from people in the community, what you're doing, how it's working, what else we can do to make sure that we are really meeting the needs of expectant parents throughout the state and being inclusive. And so like I said, here's my contact information. Feel free to email me if you have any thoughts, suggestions, questions. Happy to help. And so before we get into the presentation, I always like to start off with this video, and it's from Good Morning America. In 2017, we had a baby saved. Baby Ruby was saved when her mom noticed reduced fetal movement. She spoke up and went into her provider, and provider determined after a test that baby needed to be delivered earlier than 40 weeks. And so this was featured on Good Morning America, the Today Show, everything like that. And I think this does a good job of a couple of things. One, just setting the stage for today's talk and exciting you for what we're going to talk about today and showing you the real life impact that this campaign has. Two, that mom-to-mom storytelling is highly, highly important. Anytime we have any sort of success story or baby save or things like that, we know that that impacts moms. That's why we do so much on social media, because we know that's how we reach expectant parents. And so I wanted to show that too. And then third, it gives you a good, quick overview of the app, our Hallmark tool. And so it just kind of sets the stage. So with that, and I tested the volume with some lovely people earlier, so you should be able to hear it.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So like I said, I think that's just a really good video to set the stage. And she's right. After that, our app downloads increased like 3,700%. And we're now downloaded in over 140 countries. We have 12 languages. And so we'll talk more about the app in a little bit. But before that, I want to just make sure we're all on the same page. And I just want to go over some of the definitions and facts so we are all on the same page. So what we're talking about is obviously stillbirth. And a stillbirth is a loss of a baby after 20 weeks of pregnancy. It is further classified as either early, late, or term. And on average, 23,500 to close to 24,000 babies are born still every year in the United States. And a miscarriage is usually defined as a loss of a baby before the 20th week of pregnancy. And then we have infant mortality, death of an infant before his or her first birthday. And on average, there's around 22,000 infants that die every year in the United States, which is so sad. And so the reason I want to highlight this is because we are losing just as many babies to stillbirth as we are to infant mortality. And so we want to get to a point where we are talking about stillbirth, we are talking about stillbirth prevention just as much as we're talking about all the wonderful campaigns for back to sleep and infant mortality and things like that. That's where we want to get. And that's why you're here today, so that you can take this information back, become more comfortable talking about stillbirth and stillbirth prevention with your expectant parents, and start to change that narrative. Let's move away from, it's no longer taboo, but we need to talk about it. And this is why we lose close to 24,000 babies every year to stillbirth. Some of the causes of stillbirth, we don't go into this. Obviously, we're talking about stillbirth prevention today, but if you do want to learn more, we have some research studies you can read. This one's linked here, and this one cited that some of the most common reasons for stillbirth identified are things like pregnancy and labor complications, problems with the placenta, infection, umbilical cord issues like baby Ruby had. So like I said, there's a lot out there on the causes, just we're trying to get more on the prevention so we don't have these. So really quickly, going over the data, oops, my little thing went, but national data, this is national numbers from 2017, it's 1 in 169 pregnancies ends in stillbirth. The racial disparities are large. For Black women, it's 1 in 96. Latinx, Hispanics women, it's 1 in 199. Indigenous, it's 1 in 138. White women, 1 in 204. And Asian Pacific Islanders are 1 in 233. And again, it's just as prevalent as infant mortality. Families are actually 10 times more likely to lose a baby to stillbirth than to SIDS. If we wanted to look at Florida data, which we do, because that's where you're all located in the lovely Sunshine State. I don't think that's the Sunshine State. Anyways, Florida's stillbirth rate is 6.8 per 1,000 in 2019, so it's slightly higher than the national average. Florida is losing around 1,500 babies every year to stillbirth. That was 1,515 in 2019. There is a great website that the Florida Department of Public Health has that comes to data. If you haven't viewed it, it has all sorts of great data. It has county data. So if you're interested in your county level data, you could go to the site that's linked here if you don't know about it and view it there. It's very user friendly. And so for the statewide numbers, you can see the breakdown by race and ethnicity below, where it says white is 5.2, Hispanic women's that's 5.7, and that's all per 1,000 live births. Then you can see the Black rate, 11.5 was, it has gone down a little bit, so that's good. And then non-Hispanic Black is 10.8. So when we look at the Iowa stillbirth data, the 2020 preliminary Iowa stillbirth rate is 4.0 fetal deaths per 1,000. It's the second lowest Iowa stillbirth rate on record after 2018 and one of the lowest in the United States. And so this is showing the life of our campaign. The red line at the top represents the national stillbirth rate, and the dots in the trend line beneath it are our Iowa rates. So starting around 2003 and going through 2020, where the blue dots meet, and the red line is at 2018. So you can see that. And this is what we want to bring to Florida. We want to bring this decrease, almost 32% reduction in stillbirths in 10 years from 2008 to 2018 to Florida. And we have the ability to do that because of this great partnership with Florida Department of Health. We are bringing Count the Kicks to you for free, all the material, all of these trainings, all of these resources, giving you the tools and resources to talk about stillbirth and stillbirth prevention to save babies. And so as mentioned on the previous slide, there is that large divide when it comes to those who are more likely to experience a stillbirth. And I really wanted to take a moment to share what research has shown to be some of the causes of these disparities, because it's very important to highlight these to make sure we're continuing to elevate women of color and voices of color. So systemic racism and toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society and everything that comes with it, has led to real and pervasive health issues for Black women. Epigenetics, those physiological variations that are caused by external or environmental factors, changes in the DNA sequence over time, and then predisposition to certain conditions that may lead to stillbirth, like gestational diabetes, preeclampsia, all linked to maternal stress. Experts say Black women are less likely than other races to receive early treatment for these conditions, access to healthcare, socioeconomic barriers. One thing to note is that research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school educated white woman. So knowing about these large gaps among racial disparities in stillbirth, we have really made it a priority to focus on this issue. We have done a variety of different things and we're continuing to expand on this. We're always looking for funding opportunities. We have done several projects in Iowa that can be easily replicated across the nation. We've worked with focus groups of women of color to improve our programming. And it was from those focus groups that we did create a faith-based toolkit and outreach within marginalized communities among primarily Black beauty salons. What we found from the focus groups were, the women saying, one, they had no idea that they were at such a greater risk of stillbirth. And they were angry. They were saying, why is nobody talking about this? Why are we sugarcoating this or not talking about it? We are not delicate flowers, no woman is. And so that's why we need to talk about this. We are an inclusive organization with a full board and staff trained on implicit bias and structural racism. We have our app in 12 languages, culturally appropriate educational material. And like I said, always making sure we're elevating voices of color, women of color. We have worked with Miss Brianne Ward, who you see on your screen, to create some video, social media pieces for us. We know how important representation is. And so we want everybody to feel included, and we have this awesome video that we created that I wanted to share. All of this is on our YouTube channel. You can take this, you can share it on your social media platforms. Feel free to use. I know we're working with the Department of Health to have some web pages developed, and so all of this will be there as well. So I'm just going to share this video quick.
Did you know Black women are 2 times more likely to lose their baby in the final weeks of pregnancy than their white neighbor, colleague, or friend? It's true. For Black women, 1 out of every 96 pregnancies will end in stillbirth. As a mom and mental health counselor, these statistics are beyond troubling. They're unacceptable. At Count the Kicks, we've developed a free, evidence-based tool to help you monitor your baby's well-being in the 3rd trimester of pregnancy. The Count the Kicks app is saving lives. Here's why it matters. Studies show babies move less when they aren't doing well. Just like when adults feel sick, we want to lay in the bed or on the couch. It's the same with babies. If they are struggling, their movement changes. A decrease or rapid increase in movement is the earliest and sometimes only indication that there might be an issue with your pregnancy. The Count the Kicks app is a powerful stillbirth prevention resource, allowing moms to have a daily kick counting session to get to know what's normal for their baby. You can even share your kick counting information with your partner or friend. If you notice a change in what's normal for your baby, we encourage you to speak up to your provider. Don't wait. Hospitals are open 24/7, ready to serve you. We want you to have the joyous birth experience you deserve. Download the free Count the Kicks app today.
So like I said, you can view those videos on our YouTube channel. Feel free to reach out if you'd like to use them on your website and things like that. We can go through some of that, but I want to turn to some of the research and evidence. This is an evidence-based campaign. Evidence, research, data is very important to us, and it was very important to the founders. They all experienced stillbirth or infant loss in the early 2000s. They did not know each other at the time. They're all from Central Iowa. They actually got connected through friends and pastors, and as they were grieving together, thinking, you know, oh my gosh, I didn't think this happened, you know, this wasn't as common, but here we sit, 5 Central Iowa women who all had experienced this in the last, 9 months. It is more often, more common than people think. And so they were at, a couple of the founders went to a conference on stillbirth and bereavement, and it was there that they heard of this research study that had been done in Norway that showed when women were educated on the importance of tracking fetal movement in pregnancy, that the stillbirth rate decreased around 30% among this cohort. And so this study on your screen, this quote from Dr. Ruth Fretz, she was part of the research study and part of the presentation team that shared this with the founders at the conference. She had said, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. And so the founders thought to themselves, that's amazing. That's so simple, so easy. We can bring that back to Iowa and create something. And that's exactly what they did. They came back to Iowa, they worked with Iowa Department of Public Health and a local marketing company and created what you know today as the Count the Kicks campaign. And so we have additional research out there too. We have a whole page dedicated to research because, like I said, it's very important to us. So if you're interested in any of that, feel free to go to our webpage and look at that. I'd be happy to talk to you more about it. I don't spend too much time on it during this presentation because I really like to focus on the implementation and the app. But yes, we do have research and evidence backing this campaign. And so, like I said, if you like to read journal articles, there's a lot out there that we can point you to. So why you're here today, the implementation of Count the Kicks. Again, this is a stillbirth prevention public health campaign. It's evidence-based and it's mom-focused. It educates women on the importance of tracking fetal movement through the use of our app, or we have paper charts available. If you work with somebody that they don't have a smart device or they have Wi-Fi broadband issues quite a bit, we do have paper charts available. And one of my favorite things about the campaign is that it empowers moms, expectant parents, to speak up to providers if there is a concern. And if you look at the material, it's very bright, it's very colorful, and that was all intentional. The founders know more than most people how dark and sad stillbirth is. And so they really, truly wanted to create a campaign that was empowering, was uplifting, and that really gave not just expectant parents the education and knowledge to count fetal movement and understand it, but also for providers and anybody working with within the maternal health field, the tools and resources to talk about this with their patients. And so this is truly just the method for paying attention to babies' movements. It's a highly effective way we teach expectant parents. We teach the method for and importance of tracking fetal movement during the 3rd trimester of pregnancy. We know research shows that benefits of expectant moms tracking their baby's movements daily and learning how long it normally takes their baby to get to 10 movements is key. And you'll hear me reference normal quite a bit. And I know a couple of you had questions about what's a change and what is normal. And so we'll talk about that here in a minute. But the most important thing is after a few days, moms will begin to see a pattern. They will start to notice what the normal amount of time it takes their baby, and that's the key. Every baby and every pregnancy is different. How long it normally takes their baby to get to 10 movements. So they know if their baby's normal changes during the 3rd trimester, that could be a sign of potential problems and is an indication that the expectant mom should call her healthcare provider. And so we have this simple little form here that we can share that we've created that's just easy way to talk to expectant parents about it. And really understand the importance of tracking fetal movement daily. And our app is our hallmark tool. And so if you're watching this on your computer and you have access to your phone, I want you to right now take out your smartphone. I know this is work time and everything, but this is work related. And I would love for you to go to your app store and search for Count the Kicks and download the app, because I want you to become familiar with it. I want you to go through the steps of setting up a pregnancy profile, changing the language if you need to, and then that way you can pull out your phone when you're talking to expectant parents and show them and say, look, this is how easy it is. And it also comes in 12 languages. The languages are there. We have it in Amharic, Arabic, Chinese, English, French, Haitian Creole. We added Haitian Creole when we first partnered with Florida Department of Health. Last year was our first year. And so, they had said, we need this in Haitian Creole because of, demographics of Florida and things like that. And we listened and we did it. So Hindi, Marshallese, Russian, Spanish, Swahili, Vietnamese. It's available in Apple and Android products. Users can restart their session or delete a kick session. One of the coolest features, I think, is setting that daily reminder within the app, because remember, we want expectant parents to count at least daily and around the same time. And so you can set that up in the app and get notified when it's time to count. Even though, a lot of us are at home during this time with the pandemic and everything, we all seem busier than ever. And so trying to get kids hybrid or online and things like that. And so having that daily reminder to count is key. Expectant parents can also review kick counting history. They can download history to share with their provider, family, or friends. And this is a really important feature too, especially with telehealth appointments. They can actually download an Excel of all of their kick counting history, send it to their provider so their provider can stay up to date with it too if they're having more telehealth appointments than in-person appointments, or if their provider just wants to know, or empower your moms to say, I'm going to send this to you every couple of weeks or whatever they decide with their provider. That's really important if you work more in like a community-based setting or you're a home visitor, really talking about empowering your expectant parents to speak up to their provider and to tell them that they're using this app and what, to share with them their graph and things like that. You can count with the app for twins. You would do it, I'll show you a video here in a minute, but you just do it, you hit the little footprint every time you feel a movement for baby A, and then every time you feel a movement for baby B. And so you can count for singles or twins. You can track future pregnancies on the same profile, so you don't need to set up an account for each pregnancy. You can manage multiple devices. So let's say I have an account, but my significant other also wants to just know what my charts look like. And this is a really good time to bond with significant others and families. And so they can also be hooked up to your account to see the trend, to see the pattern. And soon this year, we're super excited because we're going to be launching it on Apple smartwatches. So you'll be able to count on your smartwatch by the end of the year. And so again, hopefully during that whole slide, you were downloading the app while you were listening and multitasking. Now you can create an account and add your pregnancy details, whether you're pregnant or not. Just go ahead and do it so you can start using it and just see how truly user-friendly it is. And so like I said, you can count for singles or twins using the app, and it really helps moms see what's normal for her baby. I emphasize that quite a bit because what we really want mom to understand is that every pregnancy and every baby is different. So after a couple sessions, the app starts showing a graph, and mom will truly be able to see in a visual way her baby's normal movement pattern. So she'll be able to say, okay, my baby gets 10 kicks in 20 minutes, and I know that's my baby's normal. I can see it on the graph. I have the data. I have actual data in my hand that I can show that to a provider for. So that way, if one day mom's counting and all of a sudden it's, 50, 60 minutes, 65 minutes, and she knows from her graph and previous sessions that it's usually around 20 minutes, that's a change. It will show that on the graph, it will jump up, and she would know that would be a time to let her provider know. And so it's really about educating mom to understand what's normal for her baby, to not compare to past pregnancies. I have had 3 children. 2 of them, my 2 boys, I would get 10 movements within 7 minutes or less, super, super quick. And then my daughter, she would get her 10 movements in 30 to 40 minutes. So I remember calling my provider a couple times and asking what to do, and going into triage once or twice to just have baby checked out. And that's really what we want. That's up to the provider to decide, what medically needs to be done after that. It's up to the mom to feel empowered to speak up if she notices a change. And so again, when we talk about a change, the app starts showing the average time it takes to get to 10 kicks right away. They'll start to see that pattern or trend. And so if mom starts noticing it takes baby closer to an hour when it usually takes 15 minutes, for example, it's time to call. If you think back to that very first video we shared with Brianne, where she says, when you and I are sick as adults or children even, we just lay around on the couch and watch TV. We don't want to move that much. And that's the exact same way with babies in utero. If something's going on, they don't feel well, they're not going to be as active. So I have a little video. There's no sound to it, but it is just going through the use of the app. So you can see you just hit that big red button, start counting, and I felt a movement. So I tapped the little footprint and the timer started automatically. So every time I feel a movement, I'm going to tap the foot again and the timer is going to start. So this section, if you just download the app, it's called a carousel. And before you even use the app for the first time, you go through like 4 or 5 of these slides that talk to you about how to use the app. And these are really important because it talks about the importance of it, when to call your provider. But you can access this at any time by clicking on the How It Works button. And so that's what I had done during counting. So this is just showing you what it says if you haven't set it up yet. Super easy, super simple. Every time baby rolls or gives you nudges or kicks, tap the footprint. If you notice a change, contact your provider. So you can see the timer was where I left it. So I'm going back to count, and I'm still doing it, feeling baby move, went out of it. Now I'm going to come back and finish it. And you can see I've only had 1 kick session. So this is what the chart looks like because I only have 1 kick session. So I'm going to fast forward a little bit. There's one. Okay, so here's 2 sessions. You can see quite a fluctuation here because of the time I was going pretty fast. So, but you can see what I want to show you is the graph and what it looks like. Here I'm setting up a reminder, super simple. Okay, this is counting for twins. I know some of you had questions about that. So I'm counting for Georgia baby 1 and Georgia baby number 2. So no sessions yet. Gonna start here in a minute. Here we go. So every time I tap the footprint, you can see if it's teal, that's the baby I'm counting for. So I just felt baby number 2 move. I'm gonna swipe over or tap and feel tap the little footprint and the timer starting for that baby. So that is exactly what you do for singles as you do for twins. So it's pretty user-friendly and self-explanatory. But again, it will show you then, I'm gonna finish. And then you would just swipe over to see, so right now you see Georgia baby 1 is highlighted, that's showing me the time for that. And if I were to tap Georgia baby number 2, it would show me that one as well. So again, I would love for you to download it and make sure you become familiar with it and all the different features. You can see here is a complete chart. The app, if you are registered and signed in, will show you the last 5 sessions on a graph like that. So it's a really good snapshot of what's going on with baby. And so you will be able to click on that. You can see the full history as well. So you don't have to worry about only seeing the last 5 sessions if you want to compare like the last 2 weeks and things like that. So you can see on this graph here, the total time is around 15 minutes. Average time is around 15 minutes, 24 seconds. So this baby gets 10 movements around 15, 16 minutes. So mom would know, let's say she's counting in one day, that jumps up to, like I said, 45, 50, 60 minutes. That graph's gonna show quite a big jump. And she's gonna say, that's not my baby's normal. I'm gonna call my provider. And what we have found is a couple of things through our research studies that we're doing, and we also have a Finnish pregnancy survey where moms, after their due date passes, the app will notify them and say, hey, just noticed you've had your due date, has baby arrived? We'd love for you to fill out this survey if so. We know that moms probably aren't using our app after baby's here, and so we still want to capture that data and evaluation though of what they thought of the app. Did it help them feel less anxious? Did it help them bond with baby? And overwhelmingly, I think it was like something like 80% that have completed the survey have said it makes them feel less anxious and bond with baby. We know, and research knows, that when you educate expectant parents on this type of campaign or this tool or this product, counting fetal movement, that they are more informed of when to speak up. So we don't need to worry about, oh, they're always gonna call or they're just gonna come in. That's not the case. And that's what research has not shown that to be the case. In fact, it's the opposite. Moms are informed of when to call, so they're not calling all the time. And so we have a sample chart there too on the screen. We have that available in English, Spanish, and Haitian Creole as well, all available to download on our website for the sample chart. So now that we talked quite a bit in length about the app, I wanted to talk a little bit more about how you can implement this and how easy it is to implement and how to talk to your expectant parents about it. First, I want to share a great video from Nancy Travis. Nancy Travis is on our medical advisory board. She also works, she's a Lee Health Cape Coral Hospital Director. She's also the AWHONN Florida section chair, and we will be presenting together at the National Conference for AWHONN, which is the Women's Health of Neonatal Nurses Conference in October. And so she has a really cool story, and I'll share it in a minute, but I want to have her share a little bit about herself and how she incorporated Count the Kicks.
Hello, my name is Nancy Travis. I'm the Director of Women and Neonatal Services at Lee Health Cape Coral Hospital and the Florida AWHONN Section Chair. I learned about Count the Kicks several years ago when I was at an AWHONN conference. I brought the information back and my team readily put it into use. A little while after that, we had a mom that noticed her baby's kicks were not what they should be. She spoke up. She came to the hospital. We did an emergency C-section as her baby was in distress and ended up with a healthy baby. We are very thankful for Count the Kicks. It is a simple, easy application that can be used by any new mom. I'm also very excited to be sharing this information with the state of Florida. We'll save more babies' lives together.
I don't know if Nancy's on today, but she is just a wonderful human, and her story is very awesome because she, like she said, she was at a conference, she picked up a brochure, learned about it, took it back and started implementing it, and lo and behold, saved a baby Deo, who we'll talk about in a little bit. You know, it's just that simple. It's just, you know, educating, talking about the importance of fetal movement. You might be thinking, you know, how do I do that? And I don't want to scare moms or, you know, things like that. And so we know that pregnancy is full of risks that we talk to moms about. Stillbirth is another risk that moms deserve to be educated about. If we think back to that focus group I talked about earlier, and how angry you know, those women were when they had no idea that they were such an increased risk, and why wasn't anybody talking about this? You know, let's not treat women like delicate flowers. And, you know, we talk to them about so much during their pregnancy, all the testing that can be done. This should be something that we should be talking about as well. And it's, you know, around their 26, 28 weeks in their third trimester, just start bringing up, do you know the importance of tracking fetal movement? Have you been feeling baby move? What are the movements like? Do you know about doing it daily? Those types of questions would be really key and important to do at every single appointment in the third trimester. Stillbirth just happens. There's nothing we can do. There can be warning signs if moms know what to look for, like reduced fetal movement is one of the early signs baby's in distress. Here's a big one that you might get from moms themselves if you're talking to them about this and saying, oh, my baby's always active, I don't need to, you know, baby's always moving. And so babies are active until they aren't. Cord and placental accidents can be sudden, and moms need to know what's normal so they can notice a change. And that's what Count the Kicks does. It helps mom understand what's normal, to visually see what's normal for their baby, so they can notice, okay, you know, my baby usually takes 5 minutes, and today it was more like 30, 45 minutes. That's not my baby's normal. She's almost at her due date. The risk of stillbirth actually increases as mom approaches or exceeds her due date. So some other misconceptions you might hear along the way as you're talking about this or sharing this with the team that we want to address. Babies move less the closer to their due date. They don't move less, they move differently. So mom may feel less sharp kicking and more rolling. However, if you're monitoring the baby's movements at the same time each day, it should take about the same time to feel those 10 movements. So whether that's, you know, those big rolls or those tiny jabs, the movement itself, it should still take around the same amount of time. Here's that active one again. Sometimes these babies are, you know, the tracking their baby's movements takes everyday guesswork out of knowing if your normally active baby has slowed down. And plus, like I talked about earlier, how, you know, we're living in such a busy, crazy world, setting up that reminder to count so you don't forget, or you don't have to think to yourself, was it 15 minutes or is it normally 45 minutes? I can't remember because, you know, I was also chasing my toddler around and things like that. And so the app helps take the guesswork out of that. Here's a big one too. I can hear baby's heartbeat on a Doppler device, so I don't need to worry about movement. A change of a baby's heartbeat is one of the last things to occur when a baby is in distress, whereas decreased movement is an early sign. I know there's some, you know, apps you can download. We just really do not recommend using a Doppler device unless you're medically trained to use one. Babies just getting ready for birth and running out of room. If you work with families or expectant parents that have multiple generations in their home, you might see or hear some of these misconceptions or myths. Totally normal, you know, for great grandma or grandma to say something like this. But we know, and we want to be sure to tell mom, baby should continue to move up to and during birth. The 10 and 2, we hear that a lot too, right? That's just easy to say, 10 kicks in 2 hours. It's a common misconception, and it's actually outdated. What research now states is that moms should be focusing on fetal movement in general and understanding their baby's pattern. Here comes that normal movement again, right? What's normal for their baby. There is a research study on this on our website. I'd be happy to share with you if you're interested, but basically what it's saying is when you put that time limit on there like that, that's kind of what the focus is for moms. So let's say, for an example, we have somebody counting and, she always gets, it's around 15, 17 minutes for baby. And one day she's counting and it's 1 hour and 45 minutes, but she thinks to herself, well, I still got it within 2 hours, so I'm totally good. But that's a big change. That's a significant change from her baby's normal movement, even though she got it within 2 hours, right? And so we want to make sure we stress to moms that it's really what's important for you and your baby, what's normal for their pattern. Another misconception is we only talk about this with our high-risk expectant women. All women should do this. We don't have only glucose tests for high-risk women. And a lot of women who do have stillbirths have no other risk factors. That's what research says. That's what our ambassadors, a lot of our ambassadors are lost moms. They have had previous healthy live births and they then have a stillbirth with no rhyme or reason. And so this is just a non-invasive tool, super simple and easy to talk about. So why wouldn't we talk about it with everybody? So when should you start talking about it? 26 weeks of high risk, 28 weeks otherwise. If you are working with moms, you're a home visitor, community-based organization, and you're seeing them perhaps a couple times a month, you can really start prepping this talk. Let's say you're seeing them and it's around 22 weeks, 23 weeks. You can say, okay, the next time I see you, we're going to be talking about Count the Kicks. Here's a brochure, take it home and read when you have time. And we'll talk about it during, when I see you next in a couple weeks around their 28th week. If you are a childbirth educator, we have a great resource and lesson plan on our website you can use and download. If you're not a childbirth educator, I still think you can use it. It's very relatable to any sort of line of work you're in. And that's what's so great about this. This is easy to replicate, it's easy to use and easy to talk about. So how do you talk about it? Saying things like, do you know about the importance of tracking your baby's movements? Let's talk about how to track your baby's movements. And then sharing how movements are jabs, rolls, pushes, anything about hiccups. Hiccups are involuntary, so they do not count towards movements. And then sharing the app, of course. If you're a provider on this call today or a nurse, taking this and saying when they come in for their glucose test, I know here in Iowa, we are supposed to drink our glucose drink in front of somebody, and then, we get our blood work and we wait an hour in the waiting room. I don't know if that happens in Florida too, but you could say, take this while you're waiting, download the app, and then we'll talk to you about it in your room during your appointment. So be thinking about ways you can integrate it into your system that you're already doing, because then it's just going to become second nature to you. So again, stress the importance of knowing their baby's normal and speaking up if there's a change. If you are working with women who, like I said, you're a home visitor, you're a childbirth educator, does mom know what number to call if she has a concern? Does she know what number or who to contact or how to contact if it's 2 o'clock in the morning? Reassure her that it is perfectly okay and acceptable to call her provider in the middle of the night if there's a concern. That is what they are there for. They will answer. If somebody doesn't answer, where is labor and delivery ER that she would want to go to. Send a brochure home or the app card, the app reminder card. Again, all free. We'll talk about the resources here in a minute. Sharing with mom that research shows evening is usually the best time to count babies' movements. It's usually when babies are most active. However, I wouldn't let this be a deal breaker. Just make sure mom finds a time where baby's most active. Maybe it's like late afternoon or right after lunch or something like that. It just needs to be the same time every day or around the same time. And then using some open-ended motivational interviewing questions, things like, tell me about your baby's movements. How is tracking your baby's movements going? Can you show me your graph? I think you'll know that working with expectant parents, you know, at least I did, the majority like to talk about their pregnancy. What are you having? What's the name? Do you know the gender? You know, things like that. And so I think they would be more than happy to say, oh, baby moves all the time. Look at this chart. It's, you know, I get all my 10 kicks in 5 minutes or less. And what questions do you have about baby's movements? You know, leaving it open-ended like that. And it is very important to ask this at every single appointment in the 3rd trimester, because it can change. And so making sure mom's aware that she should be counting daily around the same time, asking to see that graph just encourages mom to continue with it. It shows that you're invested in it as well, and that you think it's important just as it should be. So what about talking to women who have had a stillbirth previously about fetal movement? You would follow the exact same protocol. Since women who have had a stillbirth are more likely to experience another stillbirth, talk about starting to track baby's movements at 26 weeks versus 28 weeks, and talk about the previous stillbirth. Ask about the name, the gender if you weren't her previous provider or working with her at the time. Obviously, be empathetic, stay away from medical terms like fetal demise. Ask if anybody has ever talked to her about the importance of tracking fetal movement. A lot of moms we have talked to that have had previous live births have stated they were never told about the importance of tracking fetal movement. I always think about this story. I was talking to a mom out of Eastern Iowa. She had called because she was interested. She had had a stillbirth. And I remember her telling me that when she first went to her first, like in Iowa, we go to our first appointment like around 10 weeks, right? Like in the first trimester. And at that appointment, we get handed just a ton of information, a binder full of stuff, tons of information, going through first, second, third, postpartum, everything that you could ever have, right? And she said she was flipping through that one day after her stillbirth and noticed at the very back, there was a brochure about Count the Kicks. And she said, why didn't anybody shine a light on this during my 3rd trimester? Why did they leave it in this binder to just sit here hoping I would look at it? Like, why did nobody talk to me about this? And so we really want to turn those whys or why didn't, and, you know, things like that to, I did hear about this and I did know about this. And I'm so happy I learned about this. I'm so happy my providers or, you know, home visitor or organization helped talk to me about this. And so while it's important to have those educational materials everywhere, we want them in the restroom, we want them in the patient room, we have to talk about this. We have got to change that narrative. And the only way we're going to do that is by talking about it. And so the implementation, no matter what, OB, midwife, home visitor, femur, childbirth educator, it's so similar. You just become familiar with Count the Kicks, the materials in the app. You order on our website for free. You review any sample course material we have. We have a great resource called our Provider Academy. It has everything you'll ever need. It has videos you can share, documents you can download, making sure the entire team knows about the campaign and the importance of tracking fetal movement, and then documenting it, integrating into care plans. If your home visitors listening today, it's very similar. Integrate into those weekly or monthly touch points. Always asking a mom about fetal movement. This goes for everybody. And empower mom to share with her provider. So a few additional notes for everybody to take home. And I know we're ending around, it'll be a little past the hour, so bear with me as we finish up these slides. Stressing to parents to trust their instinct. If mom feels concerned or that something isn't right, call her doctor. This is really important, especially, like I said, if you have those generationals, or we know that we get our health information from a variety of different ways, right? Our moms, our grandmas, social media. Make sure you're working with mom's entire family to say, don't make mom second guess herself. If she's thinking she needs to call, don't say, oh, just wait another hour. She should call. Share that sleeping line on their left side is best for them and baby. If they wake up on their back, don't freak out. Just go ahead and move to your side. And then reviewing those common myths, right, that we talked about earlier. So next steps, download the app, practice. Make sure you share this information with all staff, order the material. Casey, who you heard from earlier, she is your contact at DOH. She's wonderful. Her contact information is there on the screen. And then other ways you can integrate as well, using a form at check-in if you're in a clinical setting. I'll talk about that in a minute. Having all your front desk staff trained and asking patients to fill out this form that I'm going to show you, and having them trained to say, oh, you know, I'm scheduling you for your third trimester, you know, 28-week appointment. Grab an app card on your way out. Here it is, and that glucose test. So here's a form that we've created to have at a clinical setting. You could also use it probably we could tweak it just a little if you're more of a community-based organization or a home visitor. But front desk staff know when somebody's there. They know if they're in their third trimester. They should say, go ahead and fill this out while you're waiting, hand it to your nurse. You detach the right-hand part there on your screen, and then that helps start the conversation, right? This is a great tool to be using that you can easily use in pretty much any setting. Another example I wanted to share, this was in Celebrate One in Ohio. They were already asking a lot of questions multiple times, and so we just had them add the section of, have you downloaded the Count the Kicks app? Yes or no, and then there's a little script. So simple things like that we can do. I'd be happy to work with you on language. I'd be happy to work with you on forms. I don't want to, you know, add more paperwork, but if we can integrate it into paperwork you're already utilizing, that would be great. And so we can work on that. And then, like I said, we have a lot of videos. We have this in English and Spanish now, thanks to our awesome partnership with Florida Department of Health. I'm going to share it in English. This is a great video to share with your expectant parents about how to use the app. Here we go.
Count the Kicks is a great way to monitor your baby's well-being, which is why many doctors recommend making this part of your daily routine at 28 weeks or 26 weeks if you're high risk. It's easy to do using our free Count the Kicks app. Just pick a time when your baby is active, preferably the same time every day. Sit with your feet up or lie on your side. Count each movement as one kick by tapping the footprint on the screen, and the app will show you how long it takes to reach 10. You'll soon get to know what's normal for your baby. If you notice a change in the strength of your baby's movements or how long it takes to get to 10, contact your healthcare provider right away. The Count the Kicks app is free and available in 12 languages. Our app makes it easy to track and save each day's kick counting session. You can even email or text your sessions to your provider or family. Don't delay. Visit the App Store to download Count the Kicks today. And remember, every kick counts.
So like I said, we have a lot of those great resources that I would highly recommend sharing with your mom. You can email it to them. We have our promo posters in English, Spanish, Haitian, Creole, all available to you for free. One of the things I love about these webinars is I get all these emails after that somebody's placed an order. And so I love seeing these come in. I know that you guys will go order these materials. They're very, very helpful and useful in having these conversations and starting the conversations. So you just go to our website and click on order materials, click on the great state of Florida, and then fill your cart. A new piece that we have that we're excited to launch in Florida is our low literacy brochures and posters in English, Spanish, or Haitian Creole. These are available now for you on our website. These would be great to have if you work with individuals where English is not their first language. You just want something that's a lot less text and more picture heavy, icon heavy. Same information as below, just a lot less text. And so feel free to order these. Just look for them and look for the description on your Florida State page when you go shopping. So we also are excited to offer you a free CE training. It's 1.5 CE, so it's 90 minutes. You just go to this website, and I will send this all in an email to you. You use the code SAVEBABIES-FL for Florida, and you are able to take this training for free. And it's very similar to what we learned today. It just focuses a little bit more on the actual research study, a little bit more on ambassadors, and less on specific Florida or like detailed information of how to integrate, and just more of the overall history of the campaign. Other free resources, like I talked about, our Parent Academy, our Provider Academy, our kick counting charts. Coming soon, we are so excited. We will have a state-specific page strictly for people in Florida. This is where you'll be able to find our data reports of how many people have ordered materials. We'll have recordings like this today will be there, so you can always access it. It will just be a great resource and tool for you that we will launch, and we'll be sure to share that with the state and all of you when that launches. So an ambassador, really quickly, we have amazing, amazing women all across the nation that are helping us with this. We could not do it without them. These women are volunteers. They are passionate advocates. They either, you know, are here because they're lost moms and they found us after, or they saved their baby and they're passionate about it and want to share this message. Either, however they get to us, they are there to help you if you have baby fairs when COVID's over, you know, things like that. If you want more of an in-person presentation eventually, and I can't fly from Iowa, unfortunately, all the time. So they can be your boots on the ground. And your Florida ambassador is Sarah Sirianni. And so she saved her baby, Ryan, was born with a true knot. And so once she noticed a change, she spoke up and contacted her provider. And so Sarah is your Count the Kicks ambassador. I can connect you with her if you ever want to talk to her or have anything else that you need. And then some other baby saves. I would highly recommend sharing this with your expectant parents. Again, that storytelling piece is truly very important. And so our baby save Deo, that is your Florida baby. That's the one Nancy was talking about. And so he is your Florida baby save that we know. We know there's more out there, and we have over 75 that we know about. This is Dana's story that I really want to share quick. And I know we're past our time, but I do love this story. And this is something you can share with your expectant.
She came back in after she had me put on the monitor and stuff. And she's like, we're just going to take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. Well, I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention to count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously. Like, it's your baby's life. She came back.
So like I said, I love what Dana says about don't feel stupid, just go in, contact your provider, don't worry about any of that because it's your baby's life. And that's so true. So there she is on the screen. So like I said, share these with your expectant parents as you're talking about this. Baby safe stories are just such feel-good stories. You can connect with us. We have Facebook, Instagram, Twitter. You can reshare our posts and things like that. And thank you. I know I went a couple minutes over, so I really appreciate your time today. I'm looking through the chat, a couple questions that I want to address. Okay, thanks all for telling me how warm it is. Does the app work for triplets and quadruplets? The app only works for singles and twins. This is what our researchers and medical advisory board have said, that it is it gets more and more difficult the more babies you add in to determine who's moving what and, you know, who's moving. And so I would have them talk to their provider about how to count and monitor fetal movement for triplets or quadruplets. So great question. Somebody said, is this available to watch again? Yes, this will be recorded, or this was recorded. I will send this out to you all. It might come as a Dropbox link because it might be kind of large, but you'll get a PDF of the slides as well. I'll also send an evaluation. I would love for your feedback. Love to hear from you. Any other questions I can answer? Thanks, Saul. You all are so kind. I'll stay on for a couple minutes if you want to ask questions. But other than that, I hope you all enjoy your lovely, sunny, warm weather. And think of me in Iowa freezing with my 34-degree temperatures. Thank you. You guys are sweet. I love it.